Here's a staggering fact: since 2000, measles deaths have plummeted by 88%, saving nearly 59 million lives, thanks to the power of vaccination. But here's where it gets controversial. Despite this massive success, measles cases are surging globally, with 11 million infections reported in 2024, nearly 800,000 more than pre-pandemic levels. What's going on? Let's dive in. According to a recent World Health Organization (WHO) report, the African region has seen a remarkable 50% decline in measles deaths, largely due to improved immunization efforts. Meanwhile, Europe reported just 8 measles-related deaths in the past year, 5 in Romania, 2 in France, and 1 in the Netherlands. These numbers are among the lowest since 2000, but this is the part most people miss: measles remains a persistent threat, especially to children, in 2025. Dr. Tedros Adhanom Ghebreyesus, WHO Director General, puts it bluntly: measles is the world's most contagious virus, and it will exploit any gaps in our defenses. He emphasizes that measles doesn't recognize borders, but when every child is vaccinated, outbreaks can be prevented, lives saved, and entire nations can eliminate the disease. Sounds straightforward, right? But here's the twist: even in countries with better healthcare and nutrition, like the United States, measles cases are rising. In 2025, the US CDC confirmed 1,798 cases, yet only 3 deaths. This raises a thought-provoking question: are we becoming complacent because mortality rates are low, even as infections spike? Globally, the numbers are alarming. In 2024, measles cases jumped by 86% in the Eastern Mediterranean region, 47% in Europe, and 42% in Southeast Asia compared to 2019. The Americas saw record outbreaks in Canada and Mexico, with 12,318 cases by October 2025, a stark contrast to the 465 cases in 2024. And this is where it gets even more complex: while deaths are down, the surge in cases suggests vaccination gaps are widening, leaving millions vulnerable. The WHO's goal of measles elimination feels distant. By 2024, only 81 countries, 42%, had achieved it. However, there's progress. In 2025, Pacific Island nations and Cabo Verde, Mauritius, and Seychelles became the first African countries verified as measles-free, bringing the total to 96. This is a huge win, but it's not enough. With cases rising, especially in wealthier nations, we must ask: are we prioritizing vaccination equity globally, or are we leaving some communities behind? Here's the bold question: as measles cases climb in countries with robust healthcare systems, are we underestimating the virus's ability to rebound? And if so, what does this mean for global health equity? Share your thoughts in the comments. Let's spark a conversation that could shape the future of measles eradication.